Good morning. Today's presentation is going to be about high cost of medications leading to untreated chronic conditions. This is group 3 and I am Mary Elkamos.
Hi, I'm Marina.
I'm Bishoy.
Hi, I'm Marini.
I'm Regine.
And I'm Rachel.
Therapy adherence is quite low. It averages 50% in developed countries. On the table on the right, we can see drug adherence to several diseases such as HIV, which sits at 56%, and asthma, which is 26%. And this can be attributed to high drug costs. So for EpiPen, for example, the drug costs increased 500% in 9 years from around $100 in 2007 to $600 in 2016, and currently it sits around $700. And Sovaldi, which is used to treat HIV, the entire course of treatment costs around $84,000. And since the drug pricing is not regulated by the government, manufacturers can set their own prices. And for such reason, medical insurance companies are starting to increase premiums and deductible amounts so that the patient pays more and they pay less. And before the passage of the Affordable Care Act, insurance companies would even deny patients with chronic diseases because of their high cost of treatment. So the patients would end up paying the entire cost of treatment for their diseases.
So, who is involved in this issue? The first people that are involved are drug manufacturing companies because they can set the prices for medication and can therefore make it very expensive. The healthcare system and insurance companies are also involved because they can focus on profit rather than patient care, and they can choose to cover less drugs in their formulary, which impacts patients with chronic conditions who have less access to their medications. Patients who pay out of pocket for their medications will also be involved because they will have higher copays and higher deductibles for their medication. Patients who are covered by Medicaid, Medicare, and other federally assisted programs are also involved because they rely on these programs for their insurance and for their drug coverage. Taxpayers and businesses are also involved because they directly fund these federally assisted programs, and employers who offer their employees healthcare benefits are also affected because they can decrease healthcare coverage for their employees and decrease the benefits. The United States economy as a whole will be affected because it funds the public healthcare, and increased cost of medication will increase the economy spending.
Okay, so who does this problem impact? The first people that are impacted are the patients. With higher medication prices and lower economic status, the patient is less able to afford the medication and therefore lower adherence and lower physical and emotional health will take place. The next group of people that are impacted are the family. On average, a family income is about $68,703 annually, and the average annual cystic fibrosis cost is about $15,571 without medical insurance. Therefore, a quarter of the income goes to healthcare costs. This also causes financial stress for the whole entire family. The next group of people that are impacted are the health insurance companies. Now, because the patient is non-adherent and has more physical and emotional health problems, insurance needs to pay more to fix these non-adherence related problems. Finally, are physicians. Physicians now have to focus on fixing the non-adherence related issues more than the prevention, and therefore there would be high patient admissions to the hospital, which causes lower focus for the physicians in higher medical errors.
Having an access to medical treatment is essential, especially for patients with chronic conditions. However, patients are already witnessing a decreasing opportunity or rights for them to access both medications and therapies they need. This is because of the continuous increase in the healthcare cost. According to a survey from Consumer Reports Best Buy Drugs in 2017, about one quarter of patients are paying more for their medications compared to how it was in the past. The survey also showed that 24% of the respondents agreed that the increased costs have reached approximately $50, while 47% stated that the increased costs have reached approximately $20. As for the 74%, or the highest from the various surveys conducted, they stated that they were not able to receive any notice ahead of time before their medication costs have increased. Hence, we need potential ways that can resolve or reduce the likelihood of this problem to continuously happen. Some of the potential ways that the issue on increased costs can be resolved or reduced involves the role of pharmacists. They are also to be considered as healthcare professionals and are capable of solving this issue we have regarding the continuous increase of medication costs for patients. Our first recommendation involves effectively integrating the professional role of pharmacists by continuously using clinical pharmacists who are practicing their license in cooperation with prescribers. We can possibly witness a reduction of the medication cost, considering that these two professions are the ones that also know the situation that the consumers, especially medical patients, are facing. The second recommended strategy again involves the role of pharmacists and their capability of to improve their compliance with evidence-based treatment guidelines. If they are able to find ways to reduce the costs by having national and evidence-based guidelines as source for the aim of reducing the cost, a study has shown that the ambulatory care alone can save $95 billion every year. The last recommendation involves the role of the patients of healthcare organization, and this can happen if they can avoid overprescribing and non-streamlined drug therapies. In the US alone, about 10% adults were known to have been prescribed unsuitable medical therapy, which results in the addition cost of $36 billion every year. If this can be done, the set resources can be provided for the needed medication of chronic patients, thereby reducing the possible higher cost for the patients. The lack of support from higher leaders in the healthcare industry is evidently one of the possible barriers to implementing the plan. If they do not have initiative to support the goal of reducing the medication cost, then this would not provide the desired result for the chronic patients. The role of pharmacists is somehow undermined, even though they also play a crucial role in providing healthcare for the patient. Another possible barrier would be lack of knowledge of the patients regarding the healthcare regulations that support their rights and can help them in the issue. Thus, we also need some actions in order to avoid or stop these barriers to take place. The possible solution to stop these barriers from preventing the plans to take place involves creating a formal appeal on how pharmacists can lead in reducing medication costs for the patients. If there would be a formal appeal that provides enough and credible evidence that can help other important members of this issue to agree and support the plan, then the barriers could also be possibly removed from the path towards the greater solution for everyone.
Now that we know this information, what is the best approach to fixing prescription drug prices? Well, Medicare Part D is a good place to start. This is a government subsidized program which primarily serves people 65 years of age or older. Since its implementation, Medicare Part D has covered 78% of eligible adults and has increased coverage from 59% to 89%. This prescription plan can be added to both your Medicare Part A or Part B, and usually beneficiaries have 4 or more chronic conditions. So the most unique thing about its coverage is that it provides individualized plans for patients that is reevaluated annually to include any modifications in health conditions. And since it's a government subsidized plan, it provides low to free premiums to those in low income and poverty tax brackets. Other than Medicare Part D, what other options do people most in need of drug coverage have? Well, Medicare Advantage, also called Medicare Part C, is another option. This combines both Part A and Part B and will allow you to tack on a prescription drug coverage via private insurances. There's usually less leeway in your coverage for this plan and often has heightened prices when you add prescription coverage. And then there's your employment insurance, which varies dramatically in coverage, premiums, and copays. 40% of people 65 years or older are taking 5 or more medications. So by the time you'd utilize it most, those beneficiaries are usually preparing for retirement.
Okay, so what can pharmacists do to help make medications more affordable for patients? Pharmacists can offer comprehensive medication reviews as part of medication therapy management. During these reviews, the pharmacist can go over affordability with the patient and advocate any changes to be made if the medication is too expensive. A lot of patients are covered under Medicare Part D, And though they are not paying entirely out of pocket, the copay may not always be one that they can afford. And also the formulary is always changing, so it's not always guaranteed that the medication will be covered. If medication is not covered by insurance, there is another option available for patients, and these are manufacturer coupons. And so GoodRx is commonly used, and this is a site that basically patients can go on, search up their medication, and find a coupon that significantly lowers the cost of their medication. RX Saver is a discount card that that especially is good for patients with chronic illnesses and helps them save up to 85% on medication prices. Substituting a generic for a brand name medication is obviously the first option if a patient is unaware or not already on the generic. Pharmacies also offer a 90-day supply rather than a 30, and this is oftentimes a better deal for the patient and also beneficial for those who have chronic conditions, as they will be on the medication for an extended period of time. And pharmacists can also send a request to the physician for a cheaper alternative, and iMedicare is a tool that pharmacists can use to look up alternative medications that are covered by the patient's insurance.
Current limitation of the program includes that it only covers certain populations, such as people who are 65 and older, or who are Current limitation of the program includes that it only covers certain populations, such as people who are 65 and older, who have end-stage renal disease, or who are disabled. And for expanding the program, we'd need more funds, which would come from taxes. However, the idea of increasing taxes would be opposed by a lot of people. Another barrier is price regulation laws would be hard to pass. Currently, Medi-Cal and Medicare cannot negotiate prices with manufacturers, so manufacturers can set their own prices. And the presence of pharmaceutical lobbying groups makes it harder for any laws that regulate prices of drugs to be passed by Congress.
Some other barriers in implementing the plan includes pharmacists. Since they get about 25% of drug prices, lowering the drug prices would also lower the pharmacist's profit. Next comes patient engagement, since without their acceptance to the new therapy, the new plan would not be able to succeed. Also, due to comprehensive medication review, that could cause confusion or distrust in the healthcare system just because of the different therapies that the patient is getting. Finally comes prescribers. Due to comprehensive medication review, prescribers now need to fix the prescriptions instead of taking new patients, which might decrease their income as well. Thank you. We hope you enjoyed our presentation, and if you have any questions, please feel free to ask us.